For Session Update, I'm Shannon Lurkey. On Thursday evening, Governor Dayton signed the Health Premium Relief Bill, which will lower monthly health insurance premiums by 25% for Minnesotans who purchase health care in the individual market, but who do not qualify for federal subsidies. Because open enrollment ends this coming Tuesday at midnight, MNsure CEO and the Commissioner of Minnesota Management and Budget called a press conference urging Minnesotans without health insurance to quickly sign up for health insurance. Here's that event.
Good morning. I'm Myron Franz, Commissioner of Minnesota Management and Budget. I'm joined today with Allison O'Toole, CEO of MNsure. Today's message is simple. Minnesotans buying insurance need to buy it today. They need to do it this weekend, and they must enroll by midnight, January 31. We need your help in the media to help get this message out. We want to make sure that we clearly articulate what Minnesotans need to do to get their coverage. If you enroll by January 31 and you're buying insurance on the individual market and you do not receive federal tax credits, you will get a 25% automatic discount on your premium insurance bill. Yesterday, Governor Dayton signed a bill to provide an automatic 25% reduction in health insurance premiums for 2017. We estimate that more than 125,000 Minnesotans may qualify for this 25% premium relief. This means eligible Minnesotans will see a 25% automatic discount on their insurance premiums for their insurance that were purchased through the individual market. Governor Dayton's relief plan authorizes $312 million to provide a 25% reduction in monthly premiums for all Minnesotans who buy insurance on the individual market and if they do not receive federal tax credits. The plan, which was developed in discussions with the Minnesota health insurance companies, will be implemented immediately, with relief coming to Minnesotans as early as April of this year. So here's how it works. First, this automatic 25% discount is not for people who get their insurance through their employer, nor is it for people who receive federal tax credits in 2017. The automatic 25% discount is for Minnesotans who buy health care insurance on the individual market and do not receive a federal tax credit. Here's what you need to know. If you do not have health insurance, please sign up by midnight, Tuesday, January 31st. You can buy your health insurance directly from a health insurance company, or you can go through MNsure. You cannot enroll in insurance after January 31st unless you have a qualifying life event. So sign up now. If you enroll by January 31, you will see a 25% discount on your bill by April and for the rest of the year. If you've already purchased coverage on the individual market, or if you've just recently enrolled and you're not receiving a federal tax credit, you'll see a 25% automatic discount on your bill beginning in April and then each month for the rest of the year. There is no application, no waiting to be approved. If you are eligible, you will get the 25% automatic discount. The 25% automatic discount is retroactive to January 2017. For eligible Minnesotans, your insurance plan will reimburse the 25% relief for previous months in 2017, either on your monthly invoice or by direct payments. We have a website up and running, mn.gov/relief25, where you can go to learn more about this relief program. We have frequently asked questions on the website, and we also have contact information. We will continue to update that page as we have new information on a daily basis. We are working with the health insurance companies to make sure this gets implemented as quickly as possible. And finally, I just want to reiterate, it's with your help, the media today, that we're asking for communication so that people understand if they qualify and what they need to do to qualify by purchasing insurance if they haven't done so by January 31st. I'll now turn it over to Allison O'Toole, CEO of MNsure. Thank you.
Or I can move here. Is that better? Good. Is that good? You want to reposition?
So you didn't care what I said.
This microphone is directional this way, Commissioner.
I see. Better? All right. Well, good morning, everyone. I'm Allison O'Toole. I'm the CEO of MNsure. Thank you, Commissioner Franz, for having me here today, and thank you all for coming. This is great news for Minnesotans. And we, as Commissioner Franz said, we need your help. We need help getting correct information to consumers because time is short. The deadline to enroll is midnight on January 31st, and we want consumers to have clear, straightforward information. I'm going to talk about two groups of individuals, Minnesotans who are already enrolled and Minnesotans who have yet to enroll. For Minnesotans who have already enrolled in a health plan through MNsure and are receiving a federal tax credit, this automatic discount doesn't apply. You don't need to do anything or worry about this. You're already getting your credit. If you are already enrolled and don't get a tax credit, and you've either enrolled through MNsure or directly with a carrier, these consumers will now automatically get state premium relief. To get the automatic discount, you don't need to do anything. You don't need to contact anyone. This will be automatic and directly from the insurer. The discount is coming in April and will be retroactive for eligible Minnesotans. The second group, and this is most important, for people who are not enrolled, they have 5 days left to enroll either directly with a carrier or with MNsure. The deadline is Tuesday, January 31st at midnight. And don't wait to do this. Get started now. You have 5 days. Get the help you need and avoid those last-minute crunches. Again, as Commissioner Franz said, if consumers are unclear about any of this, they can get clarification at mn.gov/relief25. And we're happy to take your questions.
Are you going to have any additional staff on over the weekend and into Monday and Tuesday? Are you expecting a crunch?
Yes, Bill, I think we will be busy. We've already been busy, though. We are averaging nearly 4,000 calls a day with a few minutes wait time, so things have been busy. We have extended hours this weekend. We're open 8 to 6, both Saturday and Sunday, 8 to 8 on Monday, and then 8 a.m. to midnight on Tuesday to get every last person the help that they need. And we have extra staff on too and doing overtime like crazy.
How many people have enrolled at this point in MNsure, and how does that compare to, say, last year?
Thank you. So we have over 106,000 enrollees so far. That's a 30% growth since last year. Last year, on January 31st, we ended with about 85,000 enrollees. So we are doing really well. 40% of our customers are new. And we've enrolled about 200,000 overall, including folks enrolled in public programs.
Are there going to be any circumstances where the tax credit would not give someone as much of a discount as this would?
Very, very, very limited situations. The tax credits have tripled this year. They're averaging over $600 a month, or about $7,500 a year. That is real money for Minnesotans, and the vast, vast majority of the time will be more than the 25% rebate.
Along the same line, with the capital loading activities, these are the discounts, the 25% discounts are not income dependent, correct? I mean, in the sense, I understand that the credits people get are potentially income dependent, but the 25% discount is not income dependent?
Correct. The 25% automatic discount for premium relief is not dependent on income level, and it's also, though, not taxable to the individual. So it's both not income limited, but it is not taxable.
Is that to say that Greg David's nightmare is coming true and millionaires are going to get that rebate?
The people who have high insurance premiums increasing will get relief under this plan to the extent of 25%. So if you have increasing premiums and you pay through the individual market for your insurance, you will see relief.
One thing that I've done clarification on is that most people don't pay income tax or, or 4-7%, whatever it is, whatever Mitt Romney said. So there's a margin in there where people pay income tax and qualify for a tax credit. How many people are in that sort of zone before you get to the rebate?
You're going to have to say that again.
Well, if you're not paying income tax, you don't get a tax credit, right? So you have to be paying income tax in order to get a credit.
So let me just give you
There must be a margin
high
in that
level.
zone.
I'll try and answer as best as I can, but I don't, what I'm focused on today is really reinforcing these two groups and what people need to do, the deadline that is January 31st, if you, Minnesotans can be eligible for a current federal advanced premium tax credit for individuals making up to about $47,000 a year, or a family of four making $97,000 a year. That is the current federal tax credit.
So I think, thank you, Allison. I think the key is to remember that if you go through MNsure and find out whether you qualify for the federal tax credit or not, and if you get the federal tax credit, you claim it. But if you don't claim the federal tax credit, you're eligible for the 25% premium rebate regardless of income. And so our goal today is to make sure people realize that if they're buying insurance on the individual market and they don't qualify for the federal tax credit, they get the 25% discount on the premium.
If someone's income qualifies them for the federal tax credit, but they buy directly from an insurance plan and thus aren't eligible for it, would they then get the state relief instead, even if they're earning like 250% of poverty?
If people do not claim and take the federal tax credit, they are eligible for the 25% premium reduction.
Did you include that scenario in your estimate of the 125,000 that you estimate will take advantage of this?
Yes.
Do you have any way to quantify? I lost my question. Let someone else go.
It happens to me sometimes too.
Yeah.
But it's not supposed to happen to you. You're too young for
What
that.
about the average cost of the MNsure plans this time around? Do we know what the average cost is?
You know, it really depends. We can give you a whole worksheet on this. It really depends on where you live in the state, how old you are, things like that. So, you know, we can follow up with you. What is really important here today, again, is that deadline, and that people saving through those tax credits are saving triple what they saved last year. Now we have this additional relief through state funds, which is going to help another segment of the population. It's good news for Minnesotans.
Let me just follow up with that, because I think that it does strike a really important tone here, and that is strengthening the market. Clearly, we want people to have insurance, right? It's the right thing to do. It's the right thing for them and then for their families. Obviously, they're struggling with these increased premiums, but to the extent this relief, either the federal tax credit or this 25% rebate, if this can provide that incentive and that help for them to be able to afford health insurance and bring more people into the market, that is what we're looking for. And that's what Governor Dayton said on October 27th when we began this journey, and that's what he's interested in doing right now. And that's why we're here today, is to talk about how can we deliver this relief to as many Minnesotans as possible, both for their personal relief situation and for the strength of the market.
Allison, with less than 1 week remaining before the deadline, what's the situation with the caps for plans?
Well, David, thank you for that question. We do, you know, the health insurance companies limited their enrollment through caps this year. We have hit one cap, that's Medica. And if you want more information about those, further information, you can call the Department of Commerce.
Do you have any information on the off-exchange enrollment?
I don't, Chris. That's the Department of Commerce.
Commissioner, this is a question that frankly you might have able to answer, because it has to do with what's happening in D.C. or not happening, as the case may be. Okay, these federal tax credits that some number of people are receiving who are purchasing through MNsure or directly with the carriers. Is there a possibility those could go away based on what the Trump administration and the new Congress do? And if so, how does that affect this whole program? I'm talking about the 25% discount program.
I think Governor Dayton has a number of times in January and made it really clear that we can solve those problems that we know, and we can try to make sure that we do what's right for Minnesotans. We provide the kind of relief we can to Minnesotans. So this whole program, the 25% relief program, was designed to deal with the situation that we know is developing and has developed. So we don't know what's going to happen at the federal level, but our focus is what can we do excuse me, what can we do to provide Minnesotans with relief so that they can afford to buy health insurance?
And the average price of these sort of plans increased by more than 50% this year. Is there any sort of, if more people are enrolled, is that going to make a dent in premium increases next time around? Or is there some other sort of vision for keeping it down in the years that are coming up?
Well, I think one of the key issues for the governor when he proposed this premium relief was to make sure we focus on 2017. So the whole goal is to provide opportunities for people to afford health care insurance this year. I mean, frankly, when you think about it on an individual basis, and some of the people we had here at the Capitol a couple of weeks ago to talk to the press about the difficulties that they're experiencing, our number one goal is to help families, to help individuals, to help people buy insurance to take care of their health for their family and their loved ones. That's clearly number one. Obviously, we hope that this will help the market, but we really can't, we don't know what's going to happen. Now, when it comes to 2018 and the market in 2018, Governor's been really clear that we need to work on 2018, but this relief package today is designed to help 2017. And that's really what we're focused on.
I'm asking, is it if more people join the market, will it likely bring premiums down? Do we know that?
You know, that's one of the things that we'll have to see. I mean, the health of the market does depend upon the volume that people get. I mean, if you're an insurance company, just think about it from their perspective. We want to sell insurance into this market. Are there enough people here? Do you have enough folks to make it worthwhile and you can spread the risk around? So, you know, our belief is that if we have really strong numbers, it may in fact help improve the overall insurance premium next year.
Is it a surprise that you've only reached the cap on one plan, and is that possibly a function of people waiting on the sidelines, not purchasing plans, waiting for the legislature to act?
Well, you know, we have been concerned that people are waiting on the sidelines, and that's why the governor proposed this in October, and in November, and in December, and in January. So yes, we're worried about people waiting on the sidelines, but we think that this weekend, and I think Allison will find out, we'll find out how many people have been sitting on the sidelines. We know there are some people who are. We don't know how many. So our hope is that people will say, okay, with this 25% reduction, I can now afford health insurance and buy it.
Will we hit the cap before that deadline? Do you think?
That's a question for the Department of Commerce. We didn't set, yeah, I know, I get asked a lot, but, you know, we didn't set those caps, we don't set the rates. Department of Commerce is in charge of regulating those, so I don't even have that information.
But go ahead.
I was just going to say one thing based on enrollment. You know, what we're seeing is record enrollment. And I've been saying for 3 months that consumers should not wait to make this decision. The time is now to come in and shop and compare, see if you can qualify for a tax credit. You've got 5 days to do it. And we really can't stress that enough.
Do those caps add to your sense of urgency?
We don't have any information on the caps. If you have questions on the caps, we can follow up with the Department of Commerce. I understand the interest, but we don't have that information.
I think that's a fair question, if that's adding to the sense of urgency that
it's
you're feeling.
My feeling of sense of urgency actually started in October, kept growing in November and in December and in January. So 3 months after we put forward this plan, my sense of urgency hasn't changed at all. I'm concerned about families looking at this and deciding, can they afford health care for their families or for individuals? So our sense of urgency, whether the caps are reached or not, has been the same, is get people enrolled by January 31st, provide this premium relief, and make sure they have a chance to take care of their families and themselves.
Actually, there's O'Toole. Yeah, we can get the Commerce Department information, but separately. But in terms of MNsure, are you going to provide updates over the weekend in terms of enrollment numbers, and also are you able to give us any indication of, in fact, you know, have all the people on the sidelines come in and you understand what I'm asking?
I do. So we won't give enrollment numbers again until after January 31st, until after we hit the deadline. But, you know, we only have a small snapshot into the market. I mean, the Department of Commerce has the fuller picture, so that's really, the second part of that question is really for them. And I'm not trying to frustrate you, I don't have that information.
But along that line, let me just reiterate, actually, the charts really say everything we want to say today, and that is enroll by January 31st. That is the big message. And the other one is you get an automatic 25% discount if you qualify, and the average savings will be $130 per month per person, which is significant for people. And we expect 125,000 Minnesotans who can benefit. So that's the message we're asking you to help us get out there. If you're one of that group, sign up and look at how much you can save to buy insurance.
There were reports today and yesterday about the federal government pulling back some ads promoting healthcare.gov. Does that have any impact in Minnesota? I don't see why it would, but if not, have there been any other impacts? I mean, have you noted a change in the position or the service from the federal government that impacts MNsure?
So I can answer that. Thanks, Chris. You know, I'm focused on Minnesota, and we want as many Minnesotans to enroll by January 31st as possible. Our marketing campaign, which I think you're referring to, the federal government's marketing campaign, our marketing campaign is designed to educate people about how, when, and where they can protect themselves and their families. So our ads and outreach will continue through January 31st. It's business as usual. And frankly, it would be irresponsible of us to not be reaching out to consumers right now at this critical time.
What else are you doing besides having this meeting here and then what is the nature of the overall communications effort that you're engaging in?
We're trying to do a lot. So we've mentioned the website that we have up and running. We've put out some statements, and we obviously ask you folks to come here and help us with this messaging. But we'll be doing some messaging, direct messaging through our Gov delivery system, and we're going to be asking all of our sister agencies to do whatever they can to help keep that message out. We'll be doing on Facebook. We'll be putting some information out on Facebook and on Twitter. So we're doing everything we possibly can, we think, and I know that we'll be talking over the weekend on different opportunities to meet either the press or to meet with individuals. So we're available at all times, and we will be talking to different people over the weekend. I know the governor is going to be actively talking about this over the weekend as well.
Have you purchased ad airtime on television or anything like that?
We thought you would give it to us free. Well, this is a public outreach, and this is like a public service announcement. So I'm assuming you'll be asking us to come on and put these on. We haven't done that yet, but we're looking at what we could do this weekend. It's, as you know, it's this week. There's 5 days left. It's hard to get a lot done in 5 days, but we'll do whatever we can.
There's no update on the request to extend open enrollment.
Well, as you know, the governor made that request, and it was turned down. He's renewed his request, so we'll wait and see. But we don't know what's going to happen. Once again, this kind of goes back to the question about what's going on in D.C. and the extension. What we know today is the deadline's January 31st. What we know today is that we now have $312 million available to provide premium relief. And we know today who those people are. We need to reach them, get them signed up, and give them the relief.
Commissioner, you touched on this here on the last bullet point here in the front. What happens after 2017 and all long-term reforms, and that's something that the governor made some comments about. Now, exclusive of what happens in D.C. So maybe that makes this whole thing move anyway because we don't know what's going to happen there. But what kind of timelines is the governor looking at in terms of long-term reforms? What deadlines are we facing there?
Well, I think, like I said, we want to focus on getting the message out about January 31st. Really, clearly, both the governor and the legislature have talked about needing to do that the next several months. I think in February and March they want to tackle these long-term reforms, but we have to work on that right away. That's why this is step one. We've always believed that this premium relief is step one, and step two is relief for the 2018 and thereafter.
Any other questions? And then they'll stick around if you have a more detailed question after. Great.
Thanks.
Thank you all for coming.
Thank you.